Welcome to the Federated States of Micronesia Overdose Recognition and Naloxone Training, a curriculum funded by the CDC and presented by the Association of State and Territorial Health Officials. My name is Diana, and I will be your trainer for today. The purpose of this training is to review what an opioid overdose is, learn the best way to respond to an opioid overdose, and how to administer naloxone. During this training, we will discuss the opioid epidemic, addiction, and risk and protective factors related to substance use and childhood trauma. Before diving into the material, I want to better understand what you know about opioid addiction and caring for someone that overdoses. After completing this training, you should know how to describe addiction and explain naloxone access, distribution, and administration policies. You will understand the impact of adverse childhood experiences, also known as ACEs, and protective factors on drug use and addiction. We will explore and learn about risk factors, how to recognize an opioid overdose, and identify myths on reversing an overdose. Before finishing the virtual training, we will take time to review questions and test your knowledge. Statistics show that more than 700,000 people died of a drug overdose in the United States between 1999 and 2017. In 2017, 68% of the estimated 70,200 drug overdoses were opioid-related, and an estimated 130 Americans die every day from opioids. Currently, data on drug overdose and FSM is unavailable. Still, U.S. trends show an increase in prescribing opioids by healthcare providers since the 1990s. In the early 2010s, overdose deaths involving heroin increased, and in 2013, there was a sharp rise in overdoses related to synthetic opioids such as fentanyl. What you think about drug addiction may be different from what others think about it. To better understand what other people feel about it, let's pause for 5 minutes to participate in a small group activity. Discuss and share your thoughts about the negative perceptions, ideas, or opinions you or your community have about addiction. Explore the impact of these perceptions or beliefs and how we can change the way we talk about addiction. When we thoroughly understand that addiction is a disease, we can better support individuals with addiction. And to fully understand addiction requires knowing key terminologies such as stigma, reinforcement, tolerance, and dependence. Before we provide the definitions, let us first discuss how stigma can prevent effective treatment and recovery for people misusing substances. Why do you believe stigma is real? And why would stigma prevent effective recovery? So, what is stigma? It is a series of negative perceptions or opinions that a group or society has about a topic or specific set of people. Stigma can be harmful because it results in prejudice, avoidance, rejection, and discrimination. There are various ways of breaking or reversing stigma. To change stigma requires educating ourselves and others, being respectful and non-judgmental of others. It involves treating someone with addiction the same way we treat a person with a chronic physical disease. To successfully recover from addiction, community and social support are necessary. Reinforcement is the response to the process of establishing a pattern of behavior. There is a difference between positive and negative reinforcement. Positive reinforcement is the action or situation that results in a good or beneficial outcome. Someone using opioids because it relieves their pain and allows them to proceed with their daily tasks is an example of positive reinforcement that results in pleasure or a reward. In contrast, negative reinforcement refers to removing a negative feeling or behavior. If we use the same example, someone using an opioid to relieve withdrawal symptoms such as anxiety, insomnia, or tremors illustrates negative reinforcement. Both are necessary to form certain behaviors. Over time, after repeated use, A person who is addicted will no longer feel or experience the same effects of the drug they first started using. By this time, they have become tolerant of the drug. Therefore, it will take a higher dose to continue feeling the prescribed medication's initial effects. When an addicted person suddenly stops taking the drug, they will begin to experience what is known as withdrawal symptoms indicating dependence. Dependence is the result of changes in the body due to continuous exposure to a drug. However, someone dependent on a drug is not necessarily addicted. For example, an individual taking a prescribed medicine such as oxycodone following a surgical procedure may become dependent or reliant on the prescribed medication. However, this does not mean they are or will become addicted to oxycodone. Addiction differs from tolerance and dependence because it is a chronic disease. To better understand addiction, I have two definitions to share. The American Society of Addiction Medicine describes addiction as a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. The National Institute on Drug Abuse defines addiction as a chronic, relapsing brain disorder characterized by compulsive drug seeking and use despite adverse consequences. It involves functional changes to brain circuits involved in reward, stress, and self-control. Those changes may last a long time after a person has stopped taking drugs. It is an overwhelming or irresistible need to continue using a substance despite any negative or adverse effects. The effects of addiction are long-lasting, and relapse is highly likely during the long-term recovery process. Addiction and substance use disorders do not just affect the individual. They also affect the family and the entire community, including but not limited to schools, faith institutes, and workplaces. Before we can talk about how and when to use naloxone, it is essential to understand its history and policies enacted by other states. This section will provide a high-level understanding of some of those policies and questions to consider when increasing naloxone access and FSM. Various states have enacted policies to increase the public's access to naloxone and support its distribution to the public. There are also guidelines to protect pharmacists, doctors, other medical prescribers, and people like you from criminal and civil liability. FSM does not have a prescription drug abuse policy system. Still, many states have policies to increase naloxone access and distributions and rules to protect pharmacists, clinicians, and you, the layperson, from criminal and civil liability. If you are thinking about increasing access to naloxone within your state, consider questions on increasing access to the public, legal protection for medical professionals and the general public, professional regulations, and certifications. To help guide you, pause to read and review the following questions. We will be discussing adverse childhood experiences, also known as ACEs, risk and protective factors, and how these relate to an individual and their community's health behaviors and outcomes. Taking the time to cover these crucial concepts, we will equip you and the community in supporting better opioid prevention and response efforts. Understanding childhood trauma gives a holistic view of why some individuals are at a higher risk of substance abuse and overdose. Understanding protective factors for childhood trauma provides a proactive approach to increasing our families and the community's resilience and decreasing the risk of poor health outcomes or substance use disorders. ACEs are potentially stressful or traumatic incidents that harm social, cognitive, and emotional functioning. They undermine the safe, stable, nurturing relationships and environments children need to thrive. Some examples of ACEs are physical, sexual, verbal, emotional abuse, child neglect, parental substance misuse, and divorce. The toxic stress that occurs during these events can drastically alter a child's brain development and response to stress. ACEs increase the likelihood of developing chronic health issues, mental illnesses, and substance use disorders in adulthood. Understanding the impact of ACEs can reduce the stigma affecting those who have substance use disorders. Instead of judging someone for their behavior, it is best to look at the individual in the context of their home environment, neighborhood, and the larger community. We can better understand someone's disease by seeing how it was shaped and encouraged by their childhood experiences, past and present environment, economic circumstances, and social support. ACEs allow us to recognize how we can protect our children and future generations from forming chronic illnesses, such as substance abuse disorders. Risk factors are those things that increase the likelihood of a person experiencing a substance use disorder. In contrast, protective factors are those things that decrease the probability of a person having a substance use disorder or improve a person's resilience when encountering risk factors. By understanding these different factors as individuals and a community, we can find the best practices to prevent substance use and support those recovering from substance use disorders. The CDC has compiled a list of risk factors associated with violence and substance abuse among youth. Understanding these risk factors can help to promote preventive habits to decrease poor health outcomes. In contrast, protective factors help to decrease the likelihood of violence and substance use among youth. People can reduce the risk of forming a substance use disorder, experiencing child mistreatment, and even suicide by increasing family and community support and connectedness. Take a moment to review some examples of various risk and protective factors connected to unhealthy behavioral outcomes in violence and substance use. There are various ways to intervene if necessary. When evaluating chronic disease, healthcare providers can recognize the risk of ACEs in children and traumatic events adults may have potentially faced in the past. Schools, faith, and community leaders can increase connection among the overall community by strengthening healthy communication and boundaries, and advocating for and implementing ways to provide safe places for children to learn and be supported. To better understand recommended strategies and approaches to preventing ACEs, review Appendix C in the supplemental information packet. In this section, we will be discussing opioids. We will look at various opioids and explore how to tell if someone is under the influence and experiencing an overdose. Then you will learn how to administer naloxone. So, what is an opioid? According to the CDC, opioids are a class of drugs used to reduce pain. When misused, opioids are dangerous. Opioids include prescription drugs, fentanyl, and heroin. There are naturally derived opioids like morphine and codeine, highly potent synthetic derivatives like fentanyl, strong semi-synthetic opioids such as hydrocodone, and illicit opioids or illegal street drugs like heroin. People prescribed pain medication may not realize or understand that the medicine provided by the clinician may be an opioid. Take a moment to review the 3 types of opioids there are. Fentanyl is a synthetic opioid. Doctors often prescribe fentanyl to patients to relieve pain caused by cancer. Pharmaceutical fentanyl can be 100 times stronger than morphine. Carfentanil, also a synthetic opioid, is estimated to be 10,000 times stronger than morphine, 4,000 times stronger than heroin, and 100 times stronger than fentanyl. Over the past few years, illegal fentanyl has been sold and mixed with heroin, counterfeit pills, and cocaine with or without a buyer's knowledge. So, what is an opioid overdose? An overdose occurs when an excessive amount of opioids or a combination of opioids and other drugs overwhelm the body. Opioids depress or slow down the central nervous system, causing a person's breathing and heart rate to slow or even stop, which can eventually cause death. There are a variety of risk factors that contribute to an opioid overdose. The following list reveals specific risk factors that can increase someone's likelihood of experiencing an overdose. Risk factors include a history of overdose, reduced tolerance to stay away from drugs, and mixing substances, such as a stimulant or depressant that can overwhelm the body and the brain. Other risk factors include using substances by oneself and changes in strength or quantity of opioids, such as switching from short-acting to long-lasting or extended-release drugs. Medical conditions also can be a risk factor, such as lung disease or kidney or liver problems, and intentional or unintentional misuse of prescription medication to taking a friend or family member's prescription medication. Elderly patients who take multiple prescription medications are also at risk. And other risk factors are children who intentionally or unintentionally use prescription or illicit opioids that are easily accessible, and people who undergo surgery or have a cancer diagnosis. We will now discuss the differences between someone who is heavily under the influence versus someone experiencing an opioid overdose. You can tell a person is heavily under the influence by relaxed muscles, slow speech. It may look as though the person is sleeping. The individual will have a steady heart rate, normal skin tone, and responsiveness to stimuli, such as shouting, pinching, or rubbing. How do you recognize the difference between someone being under the influence versus someone experiencing an overdose? Take a moment to review the following chart. One of the most significant distinctions of an opioid overdose is the person will not respond to any form of stimuli, and their breathing will be impaired or stopped. Someone overdosing will have a limp body, deep snoring, pinpoint eyes, slow or no heart rate, blue or gray lips or fingernails, and clammy skin. When you witness an individual overdosing, there are 4 things you should not do. First, do not put the person in an ice bath or give them a cold shower to cool down their body temperature. Doing so can further depress or slow down their heart rate. Second, do not induce vomiting or give them something to drink, as they are a choking hazard. Third, do not physically harm the person, such as kicking, slapping, or aggressively shaking them. And fourth, do not inject them with any foreign substances like salt water, milk, or any other drug. Let us pause for a small group activity. For the next 5 minutes, discuss what myths you have heard in your communities or seen from the media about ways people try to reverse an overdose. We have comprehensively discussed opioids, learning what they are, and how to identify an overdose. Let's now talk about naloxone, the only way to reverse an opioid overdose. We'll go over how it works and the different types of naloxone used versus an opioid overdose. Naloxone is a non-addictive, life-saving drug. To understand how it works is to understand its effects on brain chemistry. Naloxone has a higher affinity to the specific opioid receptors in the brain than opioids do, which means it has a stronger attraction to the opioid receptors. Imagine a person receiving the drug naloxone. In the brain, naloxone attaches to the opioid receptors, blocking opioids from binding or attaching to receptors. As a result, a person experiencing an overdose can immediately show withdrawal symptoms, leading to agitated behavior. Naloxone is only useful if there are opioids in someone's system. It reverses the depression or slowing of the central nervous system and respiratory system, allowing an individual to breathe in oxygen. Administration of naloxone to someone who does not have opioids in their body will not cause them any harm. There are various ways to administer naloxone, including injection into the muscles, vein, or skin, or sprayed into the nose. Naloxone saves an individual from having a fatal overdose and gives them a chance to seek treatment and start recovery. It does not enable opioid use or increase the rise of overdoses. A benefit of naloxone is that it has a shelf life of approximately 2 years. Proper storage of naloxone requires keeping it between 59 and 77 degrees Fahrenheit. There are 3 types of naloxone that are available in an emergency overdose. Narcan is a nasal spray administered into one nostril. Naloxone also can be given by syringe and atomizer. This method of administration is a half dose each to both nostrils. The other way is an intramuscular injection into a person's shoulder or front thigh. We have covered how to recognize an opioid overdose and how naloxone works. Now we will review the necessary steps in responding to an opioid overdose and how to administer naloxone. There are 6 steps to responding to an opioid overdose. If you suspect someone may be experiencing an opioid overdose, the first step is to check for a response. Remember that if someone is experiencing an opioid overdose, that person will be unable to respond to any stimuli. When checking for a response, shout. If you know the person, call out their name loudly. If not, make physical contact with the person by tapping their shoulder and pinching their earlobe. Make sure to put on gloves before touching them. Next, rub the person's sternum. The sternum is the bone in between the chest. Then check to see if they're breathing by placing your ear above their mouth and nose, watching to see if their chest rises. Take a moment to find your sternum. Place your hand in the middle of your chest. The bone you feel rubbing it is the sternum. If the person is not breathing, immediately begin rescue breathing. Anyone can do rescue breathing, or you can start CPR, but only if certified. To begin rescue breathing, start by checking their airway to make sure it is clear and nothing is in their mouth. In this demonstration, a plastic mask is worn to help the responder, you, from exchanging fluids like saliva with the person experiencing an overdose. Putting your hand under the person's chin, slightly tilt the forehead back and pinch their nose. Begin to administer 3 breaths for 15 seconds, taking 1 breath every 5 seconds. Make sure to remember that during rescue breathing to breathe normally. Now is the time to administer naloxone. There are 3 ways to administer naloxone. Depending on what forms are available, the steps for administration may be different for you. Narcan is the most common form of naloxone used in the U.S. To administer Narcan, tilt the person's head back and pump 1 full dose into one nostril. If Narcan is unavailable, but a syringe and atomizer are available, proper administration requires a few steps. Grab the needle and pull off the yellow caps on either end of the syringe. The naloxone capsule will be in a small vial with a red or purple seal. Pull it off and screw the atomizer onto the needle. The atomizer looks like a white cone. Grip the atomizer's transparent plastic wings and screw it onto the needle's threaded end until tightly in place. Grab the naloxone. Screw the open end of this capsule into the syringe. Finally, put the tip of the naloxone spray into one nostril and push the spray half of the naloxone into the person's nose. Then administer the other half of naloxone into the other nostril. Finally, you can administer naloxone by intramuscular injection. Doing so requires injecting naloxone into the shoulder muscle or in front of the person's thigh. Here's how. Take the colored cap off the naloxone vial and stick a needle through the rubber stopper. Draw all fluid into the syringe by pulling back onto the plunger. Inject the needle at a 90-degree angle straight into the person's shoulder muscle or the front of their thigh. Empty the syringe by pushing down on the plunger. It is okay to inject naloxone through clothing. While Narcan is the most common and easiest way to give someone naloxone, you should feel comfortable providing the drug by all 3 methods in an opioid overdose. Now is the time to call 911. If you're making the call, make sure to put the person onto a recovery position. Otherwise, have someone else make the 911 call. So, what is the recovery position? It is the position you place an unresponsive person in if stepping away and leaving them alone. Lay them flat on their back, roll them slightly onto their side. Bend their top knee and push their hand, the one they're now laying on, under their head for support. This position keeps them from rolling onto their back or stomach, which prevents the airway from being blocked. If someone is not taking in oxygen, brain damage occurs. It is critical to resume rescue breathing or CPR if you are certified until the person becomes responsive. Place the mouth shield across the face and make sure their airway is clear. Slightly tilt the forehead back, pinch their nose, and begin to administer normal breaths to the person, giving one breath every 5 seconds for 30 seconds. It may take on average 1 to 3 minutes for the naloxone to start working. When assessing and responding to an opioid overdose, you must be aware of withdrawal symptoms such as vomiting, chills, fever, pain, or agitated behaviors. Someone who is going through acute withdrawal will be confused and in pain. To help calm them, let them know you have administered naloxone. If someone does not wake up after the first dose of naloxone, you may need to administer a second dose. Try and keep the person on the scene until emergency aid comes because they can go back into an overdose after naloxone wears off. Naloxone wears off after 30 to 45 minutes. During and/or after naloxone administration, make sure not to allow the individual to take more drugs, eat food, or drink. If available, place an N sticker on the individual's shirt indicating that you have administered naloxone if you cannot talk to first responders on the scene. First responders will be able to recognize that the person has had an opioid overdose reversed. We have covered a lot of material when responding to an opioid overdose. Let's review the steps for using naloxone for an opioid overdose. For the next 10 minutes, pause to watch the Narcan training video and the video on administering naloxone spray. Before we wrap up opioid prevention and naloxone training, let us go over some frequently asked questions about naloxone. Is naloxone temperature sensitive? The answer is yes. You should store it between 59 to 86 degrees Fahrenheit. Can naloxone be used on pregnant women or children? Yes, there has been no evidence showing harm to pregnant women or children. However, it can be challenging for a fetus to go through withdrawal. Pregnant women must seek medical care after receiving naloxone. Do not use naloxone if you are allergic to naloxone hydrochloride. Does naloxone expire? Yes, it can. The expiration date should be visible on the naloxone spray or vial. People may wonder if you can still use expired naloxone. The answer is yes, but it may not be as effective. Does naloxone enable opioid misuse? No, it is incredibly uncomfortable to go into acute withdrawal. Naloxone keeps a person alive so that they have a chance to seek recovery. Finally, when do people wake up after administering naloxone? On average, 1 to 3 minutes. Here we'll wrap up our time together. The trainer will guide you in the knowledge assessment before we end this training.